Welcome to our medical exam podcast, where we explore exam questions and clinical reasoning in a friendly conversation.
I am excited to share detailed insights on these challenging topics with you.
Let's begin with question 1. What is the management of the endoscopic finding, with options stenting balloon dilatation fulguration and internal urethrotomy?
The answer is fulguration, because it uses heat generated by an electric current to destroy abnormal tissue seen in superficial tumors.
Moving to question 2, a young patient with recurrent colicky abdominal pain and urine showing crystals and RBCs. What is the diagnosis among oxalate stone PKD cystine stones and glomerulonephritis?
The correct diagnosis is cystine stones caused by cystinuria and marked by the presence of characteristic crystals in the urine.
Next, for question 3, we identify the image from an upper gastrointestinal endoscopy, with possibilities including Barrett's esophagus, esophageal varices, and gastric erosion.
Esophageal varices is the answer, as these dilated veins are common in portal hypertension, especially in liver disease.
In question 4, we review an image and decide between PKD renal cyst medullary, sponge kidney, and PUJ obstruction. What does the image show?
It is showing a renal cyst, which is usually benign with management based on its size and associated symptoms.
Question 5 presents a 12-year-old child with sudden severe scrotal pain after trauma for 6 hours with an intraoperative image. What is the likely diagnosis among torsion testis, with gangrene testicular hematoma torsion testis and gangrene of testis?
The answer is torsion testis with gangrene, as the twisted spermatic cord causes loss of blood supply, leading to tissue necrosis.
For question 6, a 40-year-old female presents with a breast lump sized 5 by 6 cm and an HPE image with options of Phyllodes tumor fibroadenoma and breast carcinoma.
The diagnosis is Phyllodes tumor, characterized by its leaf-like histologic pattern and potential for malignant transformation.
Question 7 asks about the negative pressure used in VAC dressing, with choices 60-90 mm Hg90, 100 mm Hg, 120-130 mm Hg, and 130-150 mm Hg.
The optimal negative pressure is 120-130 mm Hg, which facilitates granulation and decreases edema.
In question 8, we are to identify the surgery shown in an image with options Nissen's fundoplication and Door.
The answer is Nissen's fundoplication, which is performed to treat gastroesophageal reflux disease by wrapping the stomach around the esophagus.
Question 9 shows an intraoperative image of a congenital inguinal hernia and asks to identify the structure marked among femoral vein, obturator vein, testicular vein, and inferior epigastric vein.
The structure is the testicular vein, which is important to preserve during hernia repair.
For question 10, the question is what type of biopsy should be taken from the lesion shown, with options excisional-incisional and edge biopsy.
An edge biopsy is recommended when the lesion is too large to be excised in full, and a sample from the margin is needed for diagnosis.
In question 11, we discuss how a skin graft derives its nutrition on day 3, with options plasma imbibition, inosculation, neovascularization, and none.
Nutrition is derived by inosculation, when the graft blood vessels connect with the host vessels after 3 days.
Question 12 asks us to identify the type of ulcer, with choices arterial venous trophic and diabetic foot ulcer.
This ulcer is venous in origin, typically caused by poor venous return and stasis in the lower extremities.
Moving to question 13, a 30-year-old female with neck swelling is evaluated next with options I-131 FNAC Psi T4 and FSH.
The next step is to measure Psi T4 to assess thyroid function in evaluating the neck swelling.
For question 14, we need to identify the drain shown in the image, with options Ramuvac, Jackson, Pratt, Corrugate, and Penrose.
The correct drain is Ramuvac, which is a closed suction system used to remove postoperative fluids.
In question 15, A 5-year-old girl exposed to shampoo with rotenone becomes unconscious, and we are asked which complex is inhibited with options NAD dehydrogenase, succinate DH, cytochrome C, and cytochrome oxidase.
The answer is NAD dehydrogenase, because rotenone inhibits this enzyme in the mitochondrial electron transport chain.
Question 16 presents a patient with dilated cardiomyopathy, hypoglycemia, floppy baby, and hepatomegaly, and asks for the most likely diagnosis among Pompe disease, von Gierk's disease, and Epstein anomaly.
Pompe disease is the correct diagnosis resulting from acid alpha-glucosidase deficiency, leading to glycogen accumulation.
In question 17, a 15-year-old with exercise difficulty and fat vacuoles in muscle on biopsy is evaluated with options carnitine deficiency, Pho synthase, defect LPL defect, and LDL defect.
Carnitine deficiency is the answer as it impairs long-chain fatty acid transport into mitochondria, causing fat accumulation.
Question 18 describes a farmer on a maize diet developing a rash on the face, neck, and hands, and asks which vitamin deficiency is responsible with options niacin and thiamine.
The answer is niacin deficiency, which leads to pellagra marked by a photosensitive rash.
For question 19, a patient on methotrexate develops mouth ulcers, and we are asked which compound decreases with options TMP and CMP.
Methotrexate reduces TMP by inhibiting dihydrofolate reductase, which is essential for DNA synthesis.
In question 20, we study enzyme inhibition, where increased Km and unchanged Vmax indicate which type with options competitive, non-competitive, and uncompetitive.
This is competitive inhibition since it increases Km while Vmax remains unchanged, as the inhibitor competes with the substrate.
Question 21 involves a drug given for hyperlipidemia that causes facial flushing, with options nicotinic acid, statins, fibrates, and ezetimibe.
Nicotinic acid is known to cause flushing due to vasodilation of blood vessels.
For question 22, we identify the condition that causes increased chylomicrons and lipemic serum, with options lipoprotein lipase deficiency, hypercholesterolemia, familial hyperlipidemia, and hypertriglyceridemia.
Lipoprotein lipase deficiency is the condition that leads to the accumulation of chylomicrons in the serum.
Question 23 asks which micronutrient deficiency causes anemia, gum bleeding, and the white Frankel line on X-ray, with options copper, iron, and zinc.
Iron deficiency is the responsible cause, leading to these clinical and radiologic findings.
In question 24, regarding phenylketonuria, with normal phenylalanine hydroxylase levels, we determine which enzyme is deficient among dihydrobiopterin reductase, phenylalanine hydroxylase, tyrosine aminotransferase, and dihydropteridine reductase.
The enzyme deficient is dihydrobiopterin reductase, as its deficiency affects tetrahydrobiopterin recycling.
Question 25 describes a patient with tall stature, long digits, and lens subluxation, and asks which defect is involved with options fibrillin 1 and collagen.
A defect in fibrillin 1 is responsible for these features seen in Marfan syndrome.
For question 26, a male patient with pallor, a low MCV of 53, and increased TIBC is evaluated with options iron deficiency, anemia, vitamin B12 deficiency, folate deficiency, and thalassemia.
Iron deficiency anemia is the diagnosis based on the microcytic picture and laboratory findings.
In question 27, which asks about the derivatives present in methanol poisoning, the options are formic acid and lactic acid or acetic acid.
Formic acid and lactic acid are the toxic metabolites produced during methanol poisoning.
Reflecting on all these questions, it is clear that clinical reasoning and systematic analysis are key to success in medical examinations.
A thorough understanding of pathology, physiology, and clinical presentation is essential for accurate diagnosis and proper management.
Integrating basic science with clinical practice helps in making informed decisions under exam conditions and in real patient care.
This multidisciplinary approach not only prepares exam takers for their tests, but also improves overall clinical competence in practice.
Thank you for joining us in this deep dive into exam questions and solutions with a focus on clear clinical reasoning.
We hope our discussion has provided valuable insights and guidance for your study and practice. Ending.
Thank you for listening to our podcast on medical exam, clinical reasoning, and best of luck in all your endeavors.
We appreciate your time and invite you to join us next time for more in-depth discussions on challenging clinical topics.